Oh, Dr. Shekhar, we have Dr. Chetna with us now.
Okay. Good afternoon, everyone. My name is Kunal Singla, working as Communication Officer at CHIP Foundation. It is my pleasure to welcome you all for today's Q&A session on global and Indian public health burden caused by e-cigarettes. As e-cigarette use continues to rise, particularly among younger people, we face significant challenges in understanding its long-term effect and the potential risks to both individuals and communities. Today, we are fortunate to have an expert that will help shed light on this critical topic. Our discussion will cover the health implications of vaping, including concerns around the prevalence of e-cigarette use. We will also explore the regulatory landscape and what measures can be taken to reduce the health burden associated with e-cigarette use. I hope you find the session insightful and that together we can take steps towards ensuring the safety and well being of our communities. Your participation is vital as we work together to understand the risks of e cigarettes and find solutions to protect public health. I hope you find the session insightful and look forward to an engaging conversation. Thank you all. Thank you all for your presence. Over to you, Dr. Shekhar.
Thank you, Kunal. And I can see our guest speaker, Dr. Chetna. She's there. Hi, Dr. Saab. How are you?
Hello, I'm fine.
We welcome you on board, and
Thank
we're happy that you always, look out some time for us. You always find out some time for us and for our participants who are eager to learn from experts like you. Dr. Chetna, I'll just say a few words about her. I'll just introduce her to everyone. Dr. Chetana Deshmukh is currently working as an associate professor at the Sri Aurobindo Medical College, Indore. She is an alumni of MJ and MC Wardha Medical College and Seth GH Medical College, Mumbai. She has also worked at Maulana Azad Medical College as a senior resident and has gained extensive teaching and research experience. She completed her DNB as well in 2020, along with diploma in applied epidemiology from National Institute of Health and Family Welfare. She has several publications in indexed national and international journals and has an experience of working with projects at NIHR UK, ICMR, Indian Council of Medical Research, and also the National Health Mission funded projects at Delhi. She is an active life member of Indian Association of Preventive and Social Medicine, Indian Public Health Association, and the Epidemiology Foundation of India. She has also received a Presidential Appreciation Award from the National IPSM body for her contributions made to IPSM and her work done in community medicine in the faculty category. So she has a very enriched background, and we are happy to see you here, and we are eager to learn from you as well. My interaction with Dr. Chetna started when she was working with the Astra project, I guess, right?
Right, right.
She was working with the Smokeless Tobacco Project, and this Astra project had multiple verticals in New Delhi, Noida, AIMS, and many other institutes. And she was working as the lead scientific officer in one of the sites. So and yes, I from my understanding that she has an extensive knowledge of tobacco control, and she has been working with the stalwarts who were involved with the prevention and banning the e-cigarettes, the PICA Act, and there she is, and we are going to ask a few questions today about today's topic. Now, today's topic, we have kept it as a separate topic from the rest of the topics because we have now known about the regulatory aspect. Kunal, you can stop sharing now. We have now known about the regulatory aspect about the e-cigarette ban that has been constituted in India, the PICA Act, which came out in 2019. But what exactly has been the burden which led to this ban? Okay, so what had been the public health impact? What had been the burden? What was the global scenario? What has been the local scenario? So all these questions we're going to ask from her today. And of course, yes, the participants are welcome to write down their questions in the chat box, whatever they may want to ask. So that is the session today. That is the session titled today: the global and Indian public health burden caused by the e-cigarette use. So in this regard, Dr. Chetna, the first question that I really want to ask about the global prevalence. What do you think is the global prevalence of e-cigarette use? And I really want to know how it actually contributes to the burden, the public health burden globally in the global scenario.
Yeah.
Over to you.
First of all, thank you for giving me this opportunity to address such a wonderful crowd. And always, it had been a pleasure to have a discussions with such a crowd and share platform with you, Dr. Shekhar. Always been my pleasure. So, as Dr. Shekhar had already given us a plot that e-cigarettes and PECA Act are now the upcoming topics in tobacco control. Why? Because if we see, generally everyone is aware of only smoking type of tobacco or smokeless type of tobacco. But now what e-cigarette is coming up as a new chamber, which is a secret chamber somewhere. And if we see the burden, like if we go by the numerical data, somewhere it is estimated that there are around 3 million people who are taking e-cigarettes over worldwide. But this 3 million is very less as compared to the smokeless or smoking tobacco consumption. That is about 275 millions. So this is a secret chamber which is generating in between the tobacco consumption. So that's why this kind of even a little burden will become a blast some or other day, and it will contribute a large quantity in our smoking and smokeless tobacco consumption as well. So that's why focusing on e-cigarette becomes very important. Now, I think second part, what Dr. Shekhar had asked about was the how does it contribute to the public health risk. So just focusing what we consider as a public health risk, like if that smoking e-cigarette, or I will say consuming e-cigarette, because e-cigarette is not smoked, it is consumed or it is taken in a vapor form. So consuming e-cigarettes will ultimately lead to what? The mechanism remains the same: absorption of nicotine from lungs, and then it goes to the blood to brain, and then again increased dopamine release. So mechanism is same, the how tobacco works, but the ingestion is different, the mode of ingestion is different. So that's why the effects remains the same. That is, once it goes to the lungs, it causes diseases like asthma or COPD, chronic obstructive pulmonary diseases, and ultimately interstitial diseases of the lung. If nicotine consumption again increases hypertension, then leading to cardiovascular diseases. And ultimately, when the vapors are taken inside, they lead to a smaller molecules of formaldehyde or acetaldehyde. Then at that case, these are the most cancer causing agents which are there in e-cigarettes. So that's why ultimately it leads to the high burden of public health risk. And when these diseases are to be treated, then it causes a lost economic burden on the government also, because they had to invest so many material methods and manpower in running this tobacco control national health program. So that's why they become a major public health concern for the government as well. So I think, Dr. Shekhar, the burden is less, but still posing a great threat as a public health risk. These e-cigarettes are.
Okay. Dr. Chetna, I'm confused a bit. You said that the burden is 3 million, the prevalence is 3 million.
Yeah.
Is it for the Indian scenario or for the global scenario?
Worldwide scenario.
But I think the worldwide scenario is much higher as far as reports are concerned. I think that this 3 million number was for the
Indian scenario, it might be then. Yeah.
for the Indian scenario.
This was quoted from, I think, one of the studies of Lancet published in around 2020.
Yes.
So, as per
that is the Indian scenario.
That might be the Indian scenario.
Indian scenario. Okay, talking about when you talked about the public health burden, all these cancer-causing agents are being involved in the e-cigarettes. What exactly do you think the major non-communicable disease is when we the disease of concern is when we talk about e-cigarettes on a global scale?
Okay, so if we see on a global scale, I think US and European countries are on a higher stake of consuming e-cigarettes. So if we see, even wherever it is consumed, we can say that as I told you, the mechanism remains the same. That is high nicotine consumption. So ultimately, nicotine consumption leads to hypertension and then leading to cardiovascular diseases, leading to heart attacks or any like increase in blood pressure and etc. So I think cardiovascular diseases is a major chunk. Apart from that, lung diseases can be another scenario. And lastly, as I told you, that these vapors then break down into aldehyde, acetaldehyde molecules or formaldehyde molecules, which can prompt cancer. So cancer is also one of the scenario where e-cigarettes are prompted to. So I think all these are the major contributors to the non-communicable diseases like cardiovascular diseases, lung diseases, and cancer. So I think they cause a major portion or bulk of the non-communicable diseases. So e-cigarettes ultimately are posing or imposing a lot of number of patients to these kind of NCDs.
Dr. Chetna, has there been any kind of like a verdict from premier institutes like the National Institute of Health or the American Cancer Society or anyone like that regarding the harms of e-cigarettes use?
Yes, many, I think Indian government itself is posing like Ministry of Health and Family Welfare. They have acted upon PECA. So like that, many national institutes, even there are multiple national health programs like tobacco control program is also now promoting the banning of e-cigarette. Like banning comes like it will be from start to end. Like where the cigarette is, the basics or the basic material is produced till the consumption, as many number of steps, whatever comes in between, every step is banned. So every institute, every major health institute, like whether it is a TB institute or whether it is National Ministry of Health and National Welfare. So any institute is actually banning or telling us the ill effects. Like some awareness programs are being conducted through. There are many. I think on the website they have given many pictures, pictorial stories or motivational stories for e-cigarettes as well. Like that, they're promoting now, creating awareness among the young generation, especially because young generation, I think, is the most had fallen prey to these e-cigarettes. So they are generating awareness in these kinds. All I think it will any premier institute, if you say National Institute of Health and Family Welfare, or it is Government of India or National Tobacco Health Control Program, any institute or everyone is promoting e-cigarettes, the banning of e-cigarettes because they look fancy, but they are causing the similar amount of harm as smoking tobacco.
We have a question from the participant side as well. Dr. Sriram has asked, do we have any Indian study to understand the burden of e-cigarettes?
Yeah, I think there is one publication of Dr. P.C. Gupta in 2023. We have in that he has compared e-cigarette burden from two cities, Mumbai and I think Kolkata, two cities they have compared. And in that they had done a survey. They had asked about what is the awareness of e-cigarette this young youth have. I think it was about 12 to 13% was the awareness of e-cigarette. And also, in fact, the caretakers awareness also they have considered in that study, and that was just 0.7 or 0.2%. So that was very shocking that caregivers are not aware, but the youngsters are aware, around 12 to 13. I think 12% in Mumbai and 13% in Kolkata somewhere. The data shows that.
All right, Dr. Chetna, how do you think has been the Speaker ban has this been effective in implementing the ban or not? And if you think that the ban has kind of like a weak implementation, how do you propose to strengthen this implementation in Indian scenario? This was a great step. This was a
Yeah.
big step.
Yeah.
Keep giving a blanket ban, but we see that the prevalence studies are still coming up. So there is something which is called as the black markets that is still going on.
Yes. Yes. Now,
What is your view about this ban?
yeah. Actually, PECA has been, I think, implemented from September 2019. And that was a major step by Government of India because smokeless tobacco market is such an established market in Indian scenario that banning such kind of e-cigarette was a big step. Although it was a blanket ban, as you are saying, it is a blanket ban, yes. But now I think government is taking steps. There are some loopholes, of course, But I think the prevalence studies are coming up, and people are suggesting to change the policy or the act. So government is taking into consideration. Let's first, I think, we will see what were the loopholes, what we identified in those ban. Like there is a one black market area. Now, smokeless tobacco is actually sold. Tobacco is smokeless or smoking tobacco. It is sold directly in the markets. And although there is a ban, still it is directly getting sold. E-cigarettes are not direct tobacco. So definitely there is a blanket on e-cigarettes that they can be sold very easily, because ban, as per the legal authorities, tobacco, the visible smoking or smokeless visible tobacco cannot be sold in the shops. But e-cigarettes are like pen or pen drive. If you have seen the pictures of e-cigarette, they are so fancy that you can not even identify that they are e-cigarettes. So like they must be in the shape of a pen or a pen drive or a pocket calculator. So like that, they're so fancy. So that's why I think that black marketing of e-cigarettes is very easy. Second point in this is, might we can say that awareness among the public. Like everyone sees e-cigarette as an option for smoking tobacco, which is absolutely wrong. I will tell you, this is absolutely wrong, because the effect which e-cigarette is causing on lungs or heart or your brain is same as that of what causing a smoking or smokeless tobacco. So the public awareness regarding that e-cigarette are helpful in tobacco cessation, or e-cigarettes are in while consuming e-cigarette we are consuming less tobacco. So all these assumptions of the public, they do not understand that it is same as smoking tobacco. So public awareness regarding the harmful effects of e-cigarette is, I think, on the lower side. And lastly, I think although government has given a ban, but the implementation part is somewhere lacking. The government was lacking in regulations or manpower or regular checks at the shops. Somewhere it is lacking. So the failure of this ban, I think it was a major loophole in that, that continuous checking, or you cannot identify that this is a e-cigarette and this is a fancy material to be sold. So that differentiation, lack of differentiation, I think it was a major drawback in getting in improper implementation of that particular PECA Act. So I think these were the steps in that we didn't follow, or maybe the loopholes in the PECA Act. May I know the second question, Dr. Shekhar, regarding the PECA Act? What you
I
said?
asked, what can be done to enforce a stronger implementation?
Okay, so as I told you that black marketing, first let's go one by one. Like black marketing, to stop that black marketing, the rules and regulations for production of like whatever the chemicals which are used in the e-cigarettes, the supply, production, manufacturing of all that chemicals should be banned, first of all. The combinations which are made, the flavored combinations are made, so that this the tobacco smell doesn't get into inside. So that flavored the production of such combination should be banned somewhere. Secondly, I told you that public awareness was less. So generating more and more public awareness. I think television, media, internet, social networking sites, all these are very impressive mechanisms to promote awareness among youth, because youth is more, I think, concerned with social networking right now. So whatever social sites are there, there should be videos should be I think generated, or reels should be generated. Whatever the youngsters are using, they are used to, I think that promotion method should be used to generate awareness among the public. Then I think there should be collaboration between the policymakers and actually who are working on the ground. Where once this collaboration is lacking, then you cannot show what is actually happening on the ground level and what the policymakers are thinking. So I think there should be a proper, whatever research we are doing, or I think all of you are studying now e-cigarettes. Please, I will request that do some research work on this after this classes, and please tell your research work, publish your research work, so that the government comes to know, or the higher authorities comes to know, that what is the actual prevalence, what is actually happening on the ground level regarding e-cigarettes. And I think then that loopholes will be connected to the policymakers, and that will be improved. Then I think the manpower is less. Like regular inspection should be there at all the shops. Though even there's not selling in is directly smoking or non-smoking tobacco, but inspection should be regular. There should be regular checkups, like surprise check, and penalties should be very properly given. Like they should not leave. There should be no corruption regarding the evaluation of the bans. Now, if we look at the policy level from government perspective, I think then it is very difficult because youngsters are falling prey. Government has to ensure that the youth are not in a connection of such people who are promoting e-cigarettes. So that's why creating awareness in their minds is the, I think, the first step that should be done in the minds of youngsters. It should be from the school level, or it should be from the friend circle or tuition classes and the media, social media or televisions. So all these methods government should use to generate awareness. I think that will be the best way to make them aware that e-cigarettes are equally harmful as tobacco. They are not an option for tobacco, and they are not at all used for tobacco control.
Thank you, Dr. Chetna. Dr. Sriram has raised another query. According to you, do you think there is any effect on E-Cigarettes Act to the 2019 on controlling e-cigarette use or sale? Because I don't see COTPA. I see COTPA doesn't have any provision for e-cigarettes. Maybe a modification might come up later on. What do you say, Dr. Chetna?
Yeah, I think Kotpa is totally for smoking and smokeless tobacco. And in that also, it is more for smoking, I would say. I always complain that Kotpa is favors more rules for smoking tobacco rather than smokeless tobacco. But yes, Kotpa doesn't directly say anything about e-cigarette. But as we said, there is a blanket. So in that, if anything, in some, I think some of the versions of Kotpa said that if there is any presence of any tobacco in the product. So like these lines are present in the Kotpa. So I think e-cigarette apply, that law is applicable to e-cigarette also, because the nicotine is already present in some other form. But yes, it is present. But the government officials are not taking it on a legal way. So that's why PECA Act was formed, that totally complete from manufacture to sale. Everything was banned for e-cigarette. So Kotpa doesn't say directly banning e-cigarette, but that's why in support of Kotpa, I think PECA Act was introduced in September 19. And slowly, or like Kotpa initially when it was introduced, it had a lot of resistance from all over India. The implementation was very difficult, but I think now Kotpa is taking a stand and in a better position than what it was 10 to 15 years back when it was launched. So I think same is the case with PECO also. Right now, it is just 2019, not even just 5 years past. So let's wait for some more years and strive more for people's awareness generation that yes, this is the act and it bans all these things. So I think that will play a role in better implementation of PECA. I hope I'm clear with
Yeah,
the
this
question.
answers your question, Dr. Sriram.
Yeah.
I have another question for you, Dr. Chetna,
Yeah.
from my end. Well, talking about the youth, this e-cigarette has been regarded as a gateway, as a gateway step to smoking. Okay, and we all always talk about how e-cigarettes are harmful, they causing respiratory issues, cardiovascular issues, and all those things. But but looking at the age group, what this e-cigarettes, the people who consume e-cigarettes, that age group is basically from 18 to maybe 25, 30 years, right? That is the major chunk of the prevalence has. They would obviously not be possessing any non-communicable diseases at that age, which may or may not be pre-directed to e-cigarettes. So what all harms we can basically make the youth, we can make aware the youth that this is the harm that you can get at this age if you take this habit up. Okay, so that is what I want to ask. See,
Yeah.
we talk about NCDs, but NCDs are going to come in the later stage of life. But the habit is taken up in the earlier stages. So, what all harms of e-cigarettes we can actually take up as a concern, as a cause of concern, with which we can make the youth aware.
Yeah. So I think the youth who are consuming e-cigarettes, well, let's start from them. Who are consuming, first of all, once we, even if we make them aware that this is bad, it contains nicotine and everything, what are the bad effects of nicotine one or day. The ultimately, when he tries to withdraw, there are withdrawal symptoms which are highly uncomfortable. First of all, that they will feel anxiety, depression, sleepless nights, overeating. All these are withdrawal symptoms as an effect. So those who are consuming and those who are ultimately we will tell them that after 5 years you will develop hypertension, after 10 years you will develop cardiovascular diseases. So in this case, we have to make them aware after 5 to 10 years. But currently, if we see, you will face depression in next 2 months if you do not leave this. You will, like, we have to make them aware like this, that you will face depression, you will feel anxiety very soon if you don't stop this. You will continue doing this. So like that we have to make aware. And even if we see any tobacco cessation program, if you have seen any means who those who want to quit tobacco, then of course they go through different phases. So these phases are very difficult for them as a tobacco user. So same is the case with e-cigarette user as well. They have to go through different phases and they have to face anxiety, depression, or restlessness, or hyperactivity, the uncomfortable phase they have to. So we have to make them aware of that uncomfortable phase as well, that soon you will be facing this if you try to, but that will be easy to conquer, rather than after 5 years you will be facing the cardiovascular diseases. Like that, I think we have to promote them to quit e-cigarettes as well, although it is difficult. And those, I think, those who do not use e-cigarette, I think we should definitely make them aware. I think nowadays it has been very common that youngsters now 20 and 25 years are getting heart attacks. Nowadays we are used to listening such kind of news that they are getting heart attack. We don't know what they were consuming, what were their habits. We don't know. So this might be the cause. We should tell them such stories that yes, see, the man was young. They were working in the gym and they encountered a heart attack. It is very surprising. So such kind of events also can happen. We should threaten actually them for quitting e-cigarettes as well, like this.
Thank you, Dr. Chetna. Dr. Sriram has also talked about countries like UK. They promote vaping as a smoking cessation tool, and isn't this a wrong thing?
Yeah, definitely. Vaping, like I already said, that people choose this as an option for tobacco smoking quitting. During quitting, they choose it, that they consider that e-cigarettes are less nicotine content, have less nicotine content, so they can consume that and slowly they will stop smoking. So, but this is absolutely wrong notion they have in their minds, because it is the same amount of nicotine they are consuming through vapor form. So there is no reduction in tobacco consumption, but they are continuing their habit, and there is no cessation part is absent in this. So definitely this is not an alternative for quitting tobacco, but this is like promoting tobacco consumption only. So definitely it is not an alternative for vaping. Like vaping is definitely not an alternative for tobacco cessation.
Okay. So, Dr. Chetna, there was one thing which we discussed in the last session as well. You were not there, and we had a discussion about the influence of social media on vaping and its marketing and sales and all that. So, they usually promote this as, under the school factor of using e-cigarettes. They involve so many channels, Instagram channels, and whatever they have, whatever tactic they can have.
Mm.
So, since the product is already banned in India, but these are still available unregulated. They are we have specific websites who can who also claim to deliver these products at your house. So there are several. We were having a discussion as there was some spare part components being sold as well on Flipkart and all those things. So at that point, we couldn't really discuss much about that. But today we have the time. We can probably take this topic. And how can we, reinforce our regulations in this aspect, please?
Yeah. So I think, as I told you, black marketing is one of the major loophole for banning of e-cigarettes, because there are n number of websites which are selling these kind of fancy, like I told you, they are in the form of fancy products, like school products, what Dr. Shekhar has already mentioned. School products include rubber, sharpener, pens, pencils, and pen drives. All these are, of course, they are utilities which are used in day-to-day school days, but they are in that format which can be so very well cannot be identified that they are e-cigarettes, and they are in this format, they are sold to the students. The marketing of such kind of products is done through friend group circle messaging, noting, or sending messages on Instagrams or social sites. So sending message, personal messages to the owner of that account. So personal messages are sent. So marketing is done in this way, and that they give you the link also, and they tell you the product name also which to order. In a notion that you order this pen drive, and then you will get this kind of thing. And then in that personal notes, they do not advertise it directly on the Instagram or Reels or Facebook, but they give in the personal chat boxes the product photograph, or this is the content of the nicotine in that, everything they give. So they give a link. And I think today's technology students, or I will say youngsters, are so much used to clicking the link and going into the further out of their query कि इसमें क्या होगा, इसमें क्या होगा, ये जाके क्या करूंगे. So they just click the link and they understand, they get more and more knowledge about it कि इसमें तो nicotine है, इसमें this is the content of nicotine, so and this is where it is hidden, so I will show off in front of my friends. This kind of psychology they are developing among the youngsters. And I think this is the worrisome area, because if our young generation is getting affected, we are at stake. Then if our young generation is not a healthy generation, then it is a major public health threat. So that's why I think this kind of promotions should stop, and the banning of multiple sites, like we should have authorized sites, or we should have restricted sites which are accessible to the children. I think parents and teachers both play a very crucial role in controlling or banning e-cigarette as well, because they should not give access to multiple sites or non-regulated sites to the children or youngsters in this case. And apart from then, government should also have a continuous check on that. Like we know now that the youngsters or the young population is getting targeted. So such site should be definitely under surveillance of government or as well, that whether such products are getting marketed in any form. For like under PECA also they can start this scanning of websites for e-cigarettes. So accordingly, that clause can be included in PECA in the upcoming, I think, updations.
Yeah, thank you, Dr. Chetna. I want to share an incident. Back in 2019, I guess, 2019 or 2020, I guess. 2020 it was the time. The COVID is not yet started. It was the winters, early winters. We were doing a school study and we were comparing the prevalence of tobacco use in schools versus how many schools were complying with the 100-yard law. Okay, the one school who is complying with the law, what is the prevalence of tobacco use in that? And one school which is not complying with the 100-yard law, how much is the prevalence in that? So we were having a comparison of the central region of Delhi schools. We took around 15 schools into consideration. And at that point, we also interacted with we had a awareness session. We interacted with the students, and almost each and every student has had this notion that these are completely harmless. And if you want to try smoking, you want to look cool with smoking, try the harmless option. Try the harmless option. And
Yeah.
even girls had this notion that this is something I can safely keep in my bag, and my parents will not notice it, or maybe they'll disregard it as not a harmful product. So that was a time we were really shocked about the presence of this, and all this knowledge was available to them through social media.
Yeah.
Everything was available to them through social media or from the e-commercial websites as well. So that was a time we were really shocked. Although yes, that those were the initial stages of the ban, and not many people knew about it. But we were like shocked. And yes, an interesting factor that came as well. Before the ban, the prevalence of e-cigarettes was around 3% among the youth, and after the ban, the prevalence of e-cigarettes rose to 8% in the youth. So, in fact, the ban made the people curious basically, and they went on to again social media and YouTube and whatever they could get a hold of, regarding what exactly this thing is. And obviously, a lot of industry promoters, they come in and they give appealing flavors, they give
Yeah.
harm reduction, harmless strategy, and all those things. So this is something which is very huge. एक बच्चे को पता है कि कहाँ जाके ई सिगरेट लेना है,
Exactly.
तो पुलिस वालों को क्यों नहीं पता है? और maybe they are just keeping their eyes shut.
Yeah.
है ना?
So that was one of the loopholes, I think, which the government has to address somewhere. That I told you that there should be no corruption also in these cases. So that's why the national health program becomes more effective when there are no loopholes. So accordingly, I would also like to share one of the incidents, if time permits. Can I?
Yes.
Yeah,
Please
I'll
go
just
ahead.
take
Please go ahead.
2 minutes. Like what you said, we like in Astra, we were working for smokeless tobacco actually, and we had interviewed for rural areas from students from rural schools of Delhi who were studying fourth standard. Imagine fourth standard student. And one of the questions in our questionnaire, last question was, "Do you know about e-cigarette? Have you ever consumed it?" The second two questions, only two questions regarding e-cigarettes. So in that, those students who were having knowledge of smokeless tobacco were also having knowledge of e-cigarettes at that time in 2019 itself when we had done that study. So that was the awareness in rural areas of Delhi. So we were shocked that 46% of our students from 4th, 5th, and 6th standards, they are so small. They understood what is e-cigarette. They answered the question that 46%, yes, we know what is e-cigarette. Have you ever consumed? That was around only 1 to 2%, but still they answered it and they accepted it. So we were really shocked that see how although the smokeless tobacco awareness we were assessing, but e-cigarettes also they know about. They were one step ahead. We were just working on smokeless tobacco. They were one step ahead on e-cigarettes. So that was very surprising finding for us.
I have an appeal for all the participants. Can anybody, share your experience with the e-cigarettes? If you have ever encountered, what exactly is the price? I'm not sure about this e-cigarette price. Can anybody tell us if you have ever encountered a person who's purchasing an e-cigarette? How much does it cost? How long for how long does it work? One cartridge, and what all flavors? If any of the participants can come up and say 500. Okay, Nishant has said 500. So how was it? Was it like a pen drive or was it like a conventional cigarette look or anything like that? 500 is 500 is pretty affordable for a school child. I would say they can probably save up a week or a 2 week pocket money and probably get a 500 rupee stick. Anybody else?
Can I answer, Dr. Shekhar?
Yes, please, Dr. Chetna. What is
Yeah, I
the
would like to also share that 500 is still affordable, but we had found 350 onwards in, I think that was 2020 also, but 350 onwards in CP area. It was starting from 350 onwards till they have a large variety. The cigarette shops had large variety, like 2000, 5000 bucks also they were selling. But the fanciness increased and the capacity of that liquid also increased as per the price. So that was proportional. The costing was proportional to the capacity of the vapor liquid they were having. And they were also selling the refilling, like they have channels to
cartridge?
change in that cartridge. So the refilling cartridge was like it was around 400, 500. And the cigarette, but that has to be brought from that shop only. That was particular to that device. That cartridge was designed as per that device. So that was the business strategy they were using at that time for e-cigarettes.
So 350 is nothing. They're just like, skipping a McDonald meal and they can get a
Yeah.
cigarette.
Yeah.
And for how long will that cartridge work?
I think the small cartridge, like the lowest one, which we brought because we have to collect the products also, smokeless tobacco. So we brought that. I think he told that it will work for 5 to 7 days, and like they were dependent on the gushes what you are taking in. So that was proportional. So if you consume it like thrice a day, then it will go till 7 days, 6 or 7 days. He was saying.
That's a lot.
So it
That's a
will
lot.
depend how much you are taking in a particular day also.
That's a lot. Yeah, that's a huge quantity. I would say it's going on for a week. That's enough for a person to get hooked.
Yeah.
Okay. I think Dr. Aruna ma'am has something to say. Ma'am, good afternoon. Aruna ma'am is from Indian Cancer Society. Ma'am, good afternoon. Ma'am, you're muted.
Uh, I really don't know. I have not come across any young students or young children who are consuming e-cigarettes. But one of my nephews, who is in late 50s, he was a chain smoker and had some heart issues also, and had to undergo stents and all, angioplasty. So he once mentioned that these nicotine patches he had tried, and he had tried even e-cigarettes, 1200 1500 ka imported ye wo, because he's a good corporate person, earning high salaries and maybe traveling abroad and all. So for him, getting e-cigarettes is not a very difficult thing. But I'm talking of the adults who want to quit but are unable to do it. And even at that, educated person who is at the CEO level or something, he feels that consuming nicotine through e-cigarettes probably will help him quitting smoking. So that is the type of addiction nicotine creates, that probably shuts their minds also to any logical thinking.
Exactly. Exactly. Okay. Thank you, ma'am. Thank you for sharing your experience. Yes, Nishant has responded. It looked like a pocket lollipop. For 500 rupees, anybody can, take a e-cigarette which is disguised as a lollipop. Uh, Someone has responded. Yes, I know till 10,000 as well. The price can go up to 10,000. Of course, as Dr. Chetna said, the fanciness will increase, the flavors will diversify. It goes on for 1 week. And I've heard about disposable e-cigarettes as well. You just buy it, consume it, throw it away.
I don't have any idea about it because you have to change the cartridge, refill the cartridge or change the cartridge. That is the mechanism of that e-cigarette. So accordingly, it might have been one-time use also might have been there. I have not encountered yet regarding that.
Once I mentioned last time also that I was at a restaurant, in a Chinese small little restaurant, where a girl was smoking
You mentioned.
e-cigarettes. So, I mean, on and on, one could see even the vapors coming out, and she wouldn't stop. And I was watching her very, almost like the side table. So there was one man, male with her, and he went out to change I think it was a change of the cartridge, because after some time she says there's nothing in it or something, and she was sitting there, but continuously she was inhaling the vapors. So she's right when Dr. Chetna said that the whole cartridge probably, but it must be when he went out. That means in that area also, in a Gurgaon high-end mall, they were, it must be available, because he left and he came back. So, but I never saw changing the cartridge, but it looks like that he went out, and this is only my hunch. It may not be right.
Thank you, ma'am, for sharing your experience. Do we have other questions as well from the participant side? Any queries? Anybody would like to say something? Would anybody would like to share their experience if they have encountered any person consuming e-cigarettes or something? I had a patient around a week back. Her son was consuming e-cigarettes, and I instantly informed her that I'll share the link with her to join this meeting. And her son was in probably undergraduate college, and she said that she confiscated, once she knew that he's consuming e-cigarette. She confiscated the e-cigarette, and he brought another one the very next day. And then I urged her to make him come to this meeting, but I now know that she's not joined, or maybe he has not joined. I don't see any request to join. But yes,
The worry is that when they consume and parents confiscate or the schools confiscate, they still have a lot of money with them. May start resorting to some other habits, wrong habits of procuring money, even if the parents stop giving them first, though it is very, very common in affluent families, as I mentioned earlier. But otherwise, also in middle class families, those who don't give them so much of money, it could be 500, but within 500, he just can't keep on consuming e-cigarettes and eating and entertaining his friends or whatever. So that is something more worrying, that it's not just resorting to this bad habit. They must be indulging into some other wrong practices of getting the money
Yeah.
otherwise, whether it is within the house, the parents don't come to know, they steal or whatever happens. I don't know, but that's very worrying. But unfortunately, schools, if I had been probably at that age, heading a school, I don't know if I could manage it, because it is so difficult to frisk children. The parents' resentment and the type of stories they tell their parents, it's not easy for the schools also, but they are not really, that is true, that they do not address such issues except for the school counselor or the medical doctor to whom the child is sometimes taken to. But otherwise, as a general awareness, it's very, even when we as a part of Indian Cancer Society go to them and ask them, they never give us that platform to spread that sort of awareness among the children. That's rather sad. But maybe it is the shortage of time, there are other limitations, that they can't afford to give the time. And I personally believe that giving a 15-20 minutes for 30 minutes talk to students in a large group is not going to help anyway. It should be in a small, say, one section, and you talk to them and create some sort of peer groups, trainers. That is probably the only solution when these life skills, when they start learning those, and the peers are able to persuade them to leave this habit. That's thank you.
Thank you. Thank you, ma'am. I encountered a person in US last year who was conducting a study wherein they utilized this peer group sessions on Instagram Live. So they were saying that all these people are currently using Instagram, the preferred social media tool, and why can't we conduct a peer group session on Instagram Live, and this way anyone who is interested can join and share their views on their smoking part. And it was really effective. They said, it basically took off like a chain reaction, starting off with 10 people, 20 people, then going up to 150, 180 people. So they kind of made it like a routine session for that. And that they were saying that was very helpful in discussing the concerns what they have when they are hooked on to cigarettes. And also, ma'am, as you said that this becomes, we need to have this therapy sessions, because if they don't get it once, if the parents confiscate the product, they'll find some other way to up their nicotine. They'll definitely switch to conventional cigarettes, or they'll definitely switch to something else, or maybe smokeless tobacco as well. And but yes, since these are pretty affordable, they can be obtained from anywhere. They can be, taken from anywhere. So these are a problematic concern. Even though we have a ban, but the enforcement at a larger scale is yet to be considered. On a serious note, Dr. Chetna, anything you want to
I
say?
think as a teacher, I can think that if something comes from the directorate, or the examining body like CBSE or the Directorate of Education, to the instructions to schools, this should be a part of their curriculum to, then probably, because even our own teachers are not trained in this way. They don't even know anything about it. if I had not probably joined ICS, I wouldn't have known that such a thing happens, because you never come to know. So that is another, not a very easy situation for the schools also.
Right, ma'am, absolutely right. And I think, as Dr. Shekhar said, that Instagram sessions are being helpful. So the thing which is promoting e-cigarette, we should use that platform only to curb the use also. I think that is the zehri zehar ko katta hai. We have to use that thing somewhere. And apart from this, I think yes, schools. I think, ma'am, few sessions like tobacco in our national health program. Also, we had some provisions. We conduct sessions for no tobacco sessions for schools. We celebrate World matlab no Smoking Day also. So accordingly, such kind of celebration should be promoted in schools also to generate awareness. And these are, although generating awareness, we are telling them, we are acquainting them with types of tobacco, but where we have to also tell that how harmful it is. So generating a complete awareness is necessary via schools also. Some pictorial graphics and some videos, educational videos are also there available on the Ministry of Health and Family Welfare website for for regarding e-cigarettes and smoking tobacco and everything. So I think those should be promoted more in schools rather than giving wrong information to the students. Only those authorized information should be circulated among the students for generating that awareness, I think.
Here, I want to share one thing. Our ICS endeavor in this direction for the last about must be about 15 years or so, we celebrate World No Tobacco Day, where we invite we send out letters to about 100 schools of Delhi NCR and ask them to sort of send entries for competition. And one of the competitions we do is 5 minutes skit with 5 props and 5 actors from any school for 9th to 12th class. So there are about 25 schools definitely participate in this sort of activity. We hold it in the month of April, though on 31st May it is the day, but then the schools are closed for summer vacation. So they assemble in one school, either in NCR or in Delhi, and they do nukkad natak or a small little skit, and we give prizes to the first 3 entries and 4 entries or so on. And for the juniors, we have the poster competition, as you said, that they could do something. So we do either the slogan competition or the jingle or the posters. So from 6th to 7th to 7th, 8th level. So there, when the students do that, it creates such an atmosphere in the whole school, in that auditorium where there are about 300 children or so, because अगर आपके 25 स्कूल हैं तो 5 वो आए, टीचर्स आए साथ में, और कुछ एक आध स्टूडेंट कोई हेल्प करने वाला, सामान उठाने वाला. So we have about 140 children coming from various other schools, and their own school will call to fill the space. They will have their 150 students, another one. So there is a crowd of 300, and we use some quizzes. And in this time, I'm thinking, because I'm taking care of the awareness vertical of ICS, that apart from smoking, we'll talk about the e-cigarettes as well in the form of a quiz. So that's a little endeavor. You do it in small little way. You try to hit, to strike the nail. But then how far it goes, in NGOs can do it, but schools, they at that time they do it. And it is when the children convey this message, I think at some point of time, even if 10 children can think of that yes, our students have said it, there must be some truth in it or something. So that way we try to spread awareness in schools.
Well, thank you, ma'am. Yes, indeed. This is a very good feedback from your end. Dr. Chetna, from my side, I just have one last question.
Sure.
The time is also coming to an end. See, from what I know, you have a good knowledge of how FCTC works and what all the implications are. At once a country is a member of FCTC. अभी तो मतलब I would say that on a global level अभी तो हम smokeless tobacco को ही seriously नहीं ले पा रहे थे.
Yeah.
And then e-cigarettes came into picture, and then heat not burn products came into picture. Now nicotine pouches are coming up. WHO funding has been slashed off by the US. How will this sustain? How will these legal approaches sustain? Taking into consideration such a huge population, the largest population in the world, when we cannot abide by the FCTC rules at such a minuscule level, with the ongoing problem of smokeless tobacco, with the ongoing problem of unregulated BD market, with the ongoing problem of under the table e-cigarette sales, how are we going to address such issues? And talking about the stakeholders, they have a lot to do. Everybody keeps on blaming them. They have a lot to do. How are we going to basically let all this happen?
See, I think the problems are really true that we are lack of funding, we are lack of manpower, stakeholders or advisors, advisory committees, etc. But somewhere we have to maintain a balance. Right now, we are in some position, FCTC is working, COTPA is working, PECA is working. Some or other corner of the country, it is continuously working. But if we lose hope and we will say that how it is going to be done, kuch nahi ho sakta, then I think that working, whatever the base we have formed, that will also collapse somewhere. So if we keep on trying, like for today's session, let's take example of today's session. Such small sessions also plays very important role. All those who have joined today got awareness about e-cigarettes. They will tell at least 2 people from their circle. So I think that will generate, this cycle will go on. And I think that is what is necessary to generate awareness on public level. If we go towards stakeholder side, yes, we understand there are many things for them to do, but they are continuously working. They have chains already built up chains, that how to promote things, how those things will go in depth of, like from national level to state level to district level to PHC level. So already those connections are ready. Only thing we have to percolate the knowledge. Although funds are less, but if we stop trying, then I think that will collapse all the system which is creating till date. So, and again, the burden will, it's not, now we are at least somehow resisting the public health burden which is coming up. Somewhere we have to resist it, otherwise it will give a big blast and we cannot handle that situation. Our government will only pay for future, like only will pay, they will pay for cancer treatment or cardiovascular treatment or lung treatment. Rather than that, now if whatever funding we have to channelize that funding properly, accordingly, thoughtfully somewhere, and then accordingly take actions to go on with this zeal only, that we have to create it, we have to curb the use, like we have to go with this zeal only. If we say that how we cannot handle this, that is not a solution for this problem. We have to handle, we have to tackle, because our next future generation are at stake for this somewhere.
Well, personally, if you ask me, I really don't think this is going to come up effectively. I'm sorry about that. This is my personal opinion, because this just going to be a added amendment to the ongoing act. Just a few pages added to the ongoing book. That's it. Recently, I'll explain why I'm saying this. Recently, Professor Ravi Mehrotra, sir, our founder, shared a link on Twitter that that Government of India has basically proposed to 17 agricultural research institutes on devising new methods on how to increase the production of areca nut. And they have said that areca nut, the supari, which is a class 1 carcinogen as determined by the WHO, and they have publicly announced that this class 1 carcinogen statement by WHO is misleading, and we are going to employ 17 institutes to curb this misinformation. We're going to employ 17 agricultural research institutes, they have given some 500 crores, some 87 crores for that, just to make this statement appear false, given by WHO. And in addition to that, our Honorable Home Minister Shri Amit Shah ji, they said that we are going to come up with another research institute focused only on areca nut. One new institute is proposed on a expenditure of 500 crores. That is going to be erected in Tiruchipalli. So how, if this is something that is going on, how are we going to take all these factors into consideration? E-cigarette तो बहुत कम है अभी तो, farmers association इतना है, political direction predilect कितना है. So there are a lot of factors that industry is always staying one step ahead. We can see that.
Yeah.
We have always seen that industry always stays one step ahead of us, and then things like this come up.
Yeah.
So,
I was unaware of this thing, but really feeling sad to hear this.
But that should not deter us from spreading awareness, because then we are doomed totally. We should not lose hope. We should keep on trying whichever little way we can, but some difference, because all these, it's just, this is cigarette, it comes to other things, drugs and alcohol and whatnot. So much of on one side, the government is generating so much of revenue. I mean, in a distance of about a kilometer or 2 kilometers, there are two huge liquor shops coming up in NCR. It's as if there is a wedding celebration going on, the type of decorations they have and all. So on one side, the government is earning so much of revenue. On the other side, they are trying, we are doing in our own little way, trying to spread awareness, the harmful effects of all these things. But that's how it goes. Okay, then we call it a day.
Yes. Okay, I think this is fine, Dr. Shekhar. I think you unmute.
I'm just sharing the link of the news article that I had, that I
Yeah, sure. We'd like to see.
Yeah, I'll share it in the WhatsApp. Just a second. Just a second. Maybe I'll copy paste it. Yes, I have shared the news article in the chat box for everyone to have a look at. All right. So a lot of discussions, and this will go on and go on. I understand, and we all have so many things to see, hear, say, recommend, suggest. I understand that as well. And a big thanks to our guest for today, Dr. Chetna, for sharing her expert opinion on e-cigarettes, and to Aruna ma'am as well. Ma'am has shared a lot of her lifetime experience regarding the e-cigarette use and how we can make things better in this scenario. Yes, it should never deter us, whatever may be the scenario going on outside. We should always remain focused on our objective, that is to make the world healthier and happier. And we're going to have these conversations continued in the upcoming sessions. Next session, we are going to talk about what was the next session? Kunal? Let me just look at that.
I have one question. In case one is not able to attend fully, or one session or so. So how do we come to know can we get the recording? Or
Yes, absolutely, ma'am. We were discussing on this component because we were getting a lot of requests on how we can listen to the sessions. We have recorded all these sessions, and we are going to shortly launch our YouTube channel as well, where we'll be uploading all these recorded videos. These are not presentations; these are just healthy discussions that the participants and the speakers and the panelists do with each other, and a lot of lived experience come into these discussions, which makes the session very interesting. We're going to upload all such videos on the YouTube, and we'll share the link within our networks. And we're going to have this portal as a common platform for uploading more videos as well, as and when we conduct any session. Yes.
Which videos are you talking of? The regarding, I mean, on e-cigarettes.
This session that we are conducting today, this is being recorded as a.
Okay.
This video will be uploaded.
Because next you came to ICS last September, August. We are again having that program for the university teachers on 12th is my session, though it starts at 4, but then I may miss a part of it. So that's why I was thinking then coming to Wednesday, I may not be available fully.
I'll share the link with you personally, ma'am.
Sure. Thank you.
So thank you. Yes, we have the next session on India's regulatory response to e-cigarette. We'll hear about the journey on how PICA Act was founded and then implemented. We'll discuss that. Hope that everyone attends the session, that session as well. Thank you so much for this participation and enthusiasm that you've always been showing to us. A big thank you again, Dr. Chetana. Thank you, Aruna.
My pleasure, Dr. Shekhar. Always it has been pleasure to talk to such a good group. You always bring a good crowd to me, and good brainstorming sessions we always have.
Thank you, Dr. Chetana, for your feedback.
Thank
Thank you, my colleagues, Kunal and Anshika. And we're going to take close off this session for today. Thank you, everyone. Have a good evening. Looking forward to meeting again on next Wednesday. Bye-bye. Bye-bye.